Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Tooth Talk, I have Dr. Gargi. To give you a brief introduction about Dr. Gargi Roy Goswami, she is an interdisciplinary oral healthcare professional. She is a general dentist and a geneticist by profession and an academician by passion. Presently, with a pro team, she runs the dental home in West Bengal. Dr. Gargi Roy Goswami entered her undergraduate degree in the Bangalore University and has a BDS degree from the Rajiv Gandhi University of Health Sciences. She has pursued a certificate course in dental lasers in Bangalore. Prior to her BDS, she has completed her postgraduate degree in applied genetics. That is MSc in applied genetics from Bangalore University. She has her basic research interest that caters to oral cancer genetics as well as saliva diagnostics. To make a mark and fulfill her dream, Dr. Goswami has come up with a startup, Dr. Kamlesh Roy Research and Diagnostic Private Limited, Coronas. This is the first company in the country which caters to research services and training pertaining to dental genetics. To place a mark in the scientific community, Dr. Goswami conducted the first international Saliva Symposium India 2019, Chennai. She has been honored with the Special Jury Award of Famden Dental Entrepreneur of the Year 2017 and the Indian Dental Diva Young Achievers Award in 2018. Dr. Gagi, thank you so much for joining me in today's Tooth Talk conversation and a warm welcome to you.
Thank you. Thank you for the lovely introduction. And I once again congratulate you on your endeavor of this public awareness forum, thedentaire.com. And I think it is really a very good platform where people come to know about many myths and myth busters and also about the latest things that are happening around.
In dentist. Yeah, thank you. I think I've managed to because I have an amazing support from all of you all people, all the dentists who have volunteered to come and talk on these to talk with your dentist conversations.
Right.
So Dr. Gagi, we did have a conversation previously, but considering the current lockdown situation, which is because of the COVID pandemic worldwide, and since you are into research into dental genetics, from that perspective, either from and we all know that the virus today is present in the saliva, and as dentists we use those drills. We very closely work with the mouth of the patient. The saliva is an integral part of the mouth, and we know that the drills that we use generate those very fine spray that actually can cause spread of the infection or transmission of the infection. So, from your perspective, what do you think is the current situation?
Uh, yes, it is something which has put dentists into a very not very good condition because, to be very honest, because whatever procedures we do are producing a results. Like whether it is a simple drilling of the tooth and filling or any other thing that you say. So, right now in the market, or many people are coming up, many companies are coming up with some solutions of, uh, suctions, vacuum suctions, which might pull up the results. But still, there is a need, and it is a very tough situation. And I think more innovations would be required, more affordable things would be required to come up because particularly in dental practice, it's not about putting in money and bringing up another two new devices for sucking up the aerosols, but the viability and sustainability of the practice for the doctors, I mean for the dentists as well as for the patients too, is very important. So I think with time we will all cope up with this. I'm positive about it, and definitely some as new things are coming up, and we all will be we should be hopeful that yeah, more innovations happen very soon so that we can resume practice and we can do it as safely as possible.
Correct, correct. So we all know this lockdown period worldwide is probably going to extend. We don't know as of now in India they have declared officially as the May 3rd, but in all
Right.
possibility it may get extended for a couple of weeks. Considering we are peaking now and we are yet to reach the plateau in the curve. So, Dr. Gargi, what do you think? What do you think the implications of the COVID infection would be on dentistry in terms of how the virus would be present in saliva, say the post-COVID lockdown situation?
Yes, here is one thing of very grave concern, because what happens is now that we are all shutting our clinic mostly, and we have been sitting in home. The basic human instinct would be to jump into practice once this lockdown is over. But to be very honest, if that is done like a regular schedule, which was being done, then the situation will go worse like a country like our country, because when we talk about PPEs, that is personal protection equipment, um, again that is questionable, because there are many small practices in many small villages and district towns where hygiene itself is a concern. That is an open secret. So there is nothing wrong in talking about it. So in that case also, first thing I think it should be the people who are at the policymaker level or the head associations who must decide the regulations or practical guidelines, thinking on these aspects also, because it is not only about an established dental practice in a tier one city or in metropolitans. So I think we have to be a little careful, so that when not jumping and calling in all our patients, but to maintain that pace, even social distancing in our practice is important. Because now that you see, if you would have been seeing 30 patients a day, then I think by force you have to force yourself to at least make the number as 50%. I mean, I am just giving a very arbitrary percentage. That way, the only intention behind this is to say that you cannot start that vigorous practice again um, uh, once the lockdown is over. So if you do that, you will be the I mean, the dentist would be the most risky in the state. I mean, that's already given by the bodies. Already the information is available. So we are the highest risk people in compared to any profession. So that thing has to be kept in mind. And I think updation of knowledge, whatever is happening, whatever regulations, whether it is in perspective of India or in the global perspective, as dental professionals we should be aware of all those things. We should keep us updated, so that accordingly we can, in individual basis also, if one dentist follows some rules, that will make a big
Big
change.
Yes,
Yes.
yes. So Doctor, coming very specifically to the virus being in the saliva, of course, I think now we have all the tests that are available to detect a patient who is an active infection. Now, the possibility of having the carriers is always there. So, how do you think? So, what exactly? I mean, if you can just ask you to tell what exactly is this carrier state that we keep saying. I mean, I don't know if most of our patients are aware of that.
See, the thing is, there are two things in case of this particular strain of virus, which is now a pandemic in the global perspective and everywhere. This virus, that is why we are maintaining social distancing, because we cannot stop being infected, to be very honest. Even I do not know if I am a carrier or if you are a carrier. Carrier, as in the virus will be inside the body, but it will have the person will have no symptoms at all. No symptoms, zero symptoms. That's the greatest worry with this virus compared to any other. there will be some sort of symptoms, so that you might get. But carriers are generally, they will not have any symptoms, because if you have symptoms you will do a test and then you quarantine it. So there is a, I mean, at least there is a protocol. So, but I think yeah, that's why each and every individual, whether I am a professional, dental professional, whether the patient, everybody has to follow strictly the simple uh, protocols that are being told by the World Health Organization so many times. If you go and visit their website, there is a section for public awareness, and I think that is the best source for any information, like washing hands and so many videos and things that we are seeing on the internet nowadays. So this virus, the main thing is that we can stop the spread. That is only we can do. So carrier stage is particularly is that someone who is harboring, but he is or she is unknowingly spreading. Because, like for example, when I am talking, some spit also would come out with a flow of blow of air when I'm talking. So even in that case, the virus will sustain. But when, like for example, it again differs, because when we talk about aerosols, that is the problem, because the virus is being sustaining in the air surrounding the place wherever the aerosols are created. But if it is like when you are coughing, or when you are spitting, or when you are talking with the force, when that spit comes out, the virus would be more, the sample would be like more heavier, so it falls, drops on the surfaces. So basically that is what carrier means, and the only thing that we can do right now is prevention of the virus, is to stop its spreading. So we have to be very careful, and I think we have to unlearn many things and learn new things. Very small things which are difficult, I know, but we have to. Like for example, uh, even if we open the door, we were supposed to we use our palm to open any door in the clinic, but it should be done with the elbow. While sneezing, we just sneeze like that, or sometimes we cover. So better is to sneeze like this. So these are the things that you, many guidelines are being there in the internet with authentic bodies. So all these things has to be learned. So we have many things to learn now to actually protect ourselves from not being carriers, or even unknowingly, if we are carrier, unfortunately, to not spread the virus more to anyone else.
So Dr. Gargi, since you are involved in the research area, and also pertaining to dentistry, the research in terms of saliva and dental genetics, so what do you think is happening in terms of research to find out more about this virus, or to probably find some kind of an easier test kit in terms of this virus?
Yes, like I'll talk about the perspective of India itself, because our highest healthcare body is ICMR, so Indian Council for Medical Research, and also the CSIR institutes, which have collaborated and they are doing wonderful job. Now we have many, actually, there are many companies, many labs who have come up, who have got approvals for testing. I think more than 70 labs all over India, which have got permission, or which are authorized for COVID-19 testing. And I hope in a few days more time, the number of labs getting approvals would come up, because that is like a in a process. And now in particular, actually there are two types of tests. So one is PCR based test. So from basically you collect the nasal or throat swab, and then you do the test in with a particular reaction called polymerase chain reaction, real time polymerase chain reaction, and we can pinpointedly uh, find the whether the virus is present or not. And another second type of test is rapid antibody test, which is essentially a blood test where we can detect the COVID-19 antibody. So these results, like for example, the PCR based test will take around 6 to 8 hours of time to for the results to come. And antibody tests are much more faster, around 30 minutes the results come. So many companies, big companies have come up, and one I should must mention, and you might have seen about it, is about My Labs in Pune. So they were the first to develop the kit for test kit for COVID-19 in India, and the cost is also very less for the test. It is around for the kit is around 1200 rupees, and with one kit you can do almost 100 tests. So uh, so there are many other companies and if you go to ICMR website, if you are interested, if you go to ICMR website, you can find all the protocols, you can find all the listed labs, both government and private labs, which are being approved and what exactly they are doing. And also, as I was talking about CSR institutions with ICMR, all the CSR institutions, they are trying to understand the nature of the virus, because one problem with the virus is it is changing very rapidly. So that's why to come up with a pinpointed point of diagnosis or test, whatever you say, is becoming difficult. So it is very much essential that we understand, as scientists, we should understand how the virus is changing at the genomic level. So that initiative has already been started, and CSR institutes like IGIB in Delhi, then CCMB, that is Center for Molecular Biology, and many other institutes now all over India. The scientists are behind the virus to understand what exactly is going on. Because once you know those information, only then we can come up with more pinpointed diagnostic tests, so that so that it is doesn't give a false positive result also. That is also very important issue. So there are, though the situation is kind of little negative, we are all fearful, we are sometimes frustrated, but see, there are so many positive things, and we I think we can make things more positive by just abiding by whatever we are told by the organizations of maintaining social distancing and keep our rational mind open.
Yeah. So by the look of it, dentistry probably will have to wait for maybe a little longer even after the lockdown to resume treatment for their patients. So, and I hope even our patients understand this part of it, that there is definitely a lot of change that is going to happen, how dentistry will be practiced going from now. Like how you said, this particular virus is changing its nature so frequently.
Yes,
We probably, as dentists who are in the first, the most prone,
most vulnerable. Yeah,
since we are the most vulnerable people to the infection, I think the precaution protocols, that guidelines that will be given to us is something that we have to very religiously follow, and that our patients also should probably understand that, and I know that they will understand, because I think end of the day, all of our safety is really important.
absolutely, absolutely. So that is what I mentioned, that we have to keep a rational mind open, because it is not about only the profession, it is about the people too. And in the people, as the patients come, we also come in that category. So safety is a must. And also, I am sure that with few more weeks or within few months, we will have proper guidelines from the authorized bodies who are already thinking and who have already been working on these lines. And I think we will have a proper guideline coming up where each and every dental professional can follow, as well as they give protection, ensure their protection to the patients.
Yes.
So, so yes, definitely there, as I said, there are many changes happening. It is just that we have to be very calm and we have to be very open to accept those changes, because there is no, I think, I believe that there is no barrier to learn and there is no age to learn. So I think the virus is teaching us, taking us back to school, so that once again we start from ABCD. So that's okay. I think you and me and other people, enthusiastic people, are ready to unlearn and learn new things. And I hope we will all overcome this grave situation.
Yes. So, Dr. Gargi, that was so informative that you shared with our patients about the research part of the area pertaining to dentistry. And I really hope our patients did get first-hand information about the current situation. So, so thank you so much for joining me today, and
Thank
I
you.
hope I can get you back to talk to our patients on another topic related to dental health and oral health, and maybe even oral
Sure.
cancer, like how saliva diagnostics and oral cancer,
Yes.
those topics. I think it's so much, so wide, vast. There is so much to
Yes.
discuss and
Absolutely.
to share.
Absolutely. Anytime.
Thank you,
Thank
Dr.
you, Dr. Rekha. Thank you for the opportunity. And all the best to you, and all the best to all of us.
Everybody. So, viewers, that was Dr. Gargi, who did share with us about the steps our government is taking in terms of research to find viable test options to find out about the COVID virus, and also the implications of this in terms of how dental practice will be the post-COVID situation. I hope that talk was helpful. If you have any doubts or queries, please do leave your comments in the comment section below and we will get back to you on that. And for more information about your oral health, do visit our website www.thedentaire.com. Subscribe to our YouTube channel and you can follow us on Facebook, Twitter, Instagram, and on Telegram. So until next time that I come back with another dentist with another topic to discuss on your oral and dental health, keep smiling, take care, and be happy.